Hello, it's Dr. Covington here. I just wanted to make a video to challenge you guys this summer to drink more water. Before I get into the specific challenge and a couple tips, I did want to talk about the newsletters briefly. We try to send out newsletters every single month. There are different types of newsletters. If you're watching this, you are on the active patient newsletter. There's newsletters for people who just come to the website and want to subscribe. There are newsletters for a meal replacement program. So this one is more exclusive for patients who are actively enrolled, and you are seeing me routinely. What you will start to notice with the newsletters is that you'll get more in-depth information. We're starting to send out more recipes. I'll be doing more videos like this, particularly when I see a lot of common things across the entire group. One example is constipation. A lot of you are constipated, so we need to talk about that more. We do have a blog coming out about constipation in the near future. But what I wanted to talk about first is water. Your water intake is extremely important, and especially with the type of summer that we're having. We have 95-degree weather. You need to be hydrated. Some of you are coming into the game dehydrated already. You're not used to drinking enough water, and that can create a lot of issues with your appetite, but also with the way that your body and the cells function. So I understand you guys are busy throughout the day. You are working. The great majority of my patients are professionals. Some of you are physicians. You guys are nurses, medical assistants. You guys are attorneys, pharmacists. You own businesses. You're small business owners like me. And you're traveling. I've got a large percentage of you guys who are traveling internationally or traveling across the United States, and you don't want to be using the bathroom all day long. I totally get that, but guess what? You got to get the water in anyway. So I'm going to give you a couple tips for what has worked for me, but also what I have seen work for some of my professionals who are busy. Some of you have heard this before, so I'm going to say it to the entire group. Drink the first 40 ounces before you leave for the day. The other thing that I will say is that your body will adjust to whatever you do. If you go from drinking 12 ounces a day to 64 ounces, those first couple weeks, you're going to be going to the bathroom every hour. But eventually, your body will adjust to that, and you will not be, using the restroom as much. But how do I get 40 ounces in? I use this Pogo bottle. I got this off of Amazon for $4. I don't think that they have that type of deal anymore. But it doesn't have to be this bottle. It can be any bottle. I like this because I know if I drink the whole bottle, it's 40 ounces, and it's easier for me to keep track. This is my second bottle for the day, and it's only 8 o'clock in the morning. I drank the first one before I even left. So how do you do this? You drink while you're getting ready in the morning. When you get up in the morning, start drinking. Drink while you're washing your face, while you're taking your shower or in and out of the shower, while you're making breakfast for your children. But finish the whole bottle before you even leave. If you can't finish the whole bottle, try to get through half of it and drink the other half when you get to work. That way, your first 40 ounces is done, and your body really benefits from that hydration first thing in the morning. You should notice a lot of things from drinking water. Clearer skin, feeling better, more controlled appetite. It definitely can make you feel fuller, especially if it's hotter water, like lemon water, things like that. If you don't want to do pure water, you can put a little bit of apple cider vinegar in it. It gives it a little bit of a tang or a different taste. You can put the water packets in here. I recommend that you do the ones that don't have aspartame, like True Lemon or True whatever flavor it comes in. Sparkling water counts. Coffee has water in it. However, you also have a diuretic in the coffee. The same thing with tea based on how much caffeine is in it. Tea can count. It kind of depends. To keep it clean, I would say try to do pure water. That way you don't have any questions about how much water you've actually gotten in. If you can do 40 ounces first thing in the morning, you have gotten more than half of what you need for the entire day. If you are exercising and active, many of you are, then you need more water. I drink 80 ounces of water a day. That works really well for me. The other thing, diet sodas. Yes, you have water in diet soda. but you're also going to get some salt and some other potential chemicals, aspartame, stuff like that. The last thing is that I drink straight out of this bottle, but some people notice that a straw helps, having a nice cup, a pretty cup, glitter on their cup. It's motivating. I gave away a water reminder last month, something that went off every 30 minutes to remind you to drink water if you hadn't within that time frame. So just a plug, make sure you're watching social media. Sometimes I give things away, or I'm giving away tips or food finds, stuff like that. The thing with the straw, bariatric surgery patients, you guys know that you can't drink out of a straw. It introduces gas and air into your pouch. But for the rest of you, try a straw. Whatever you do, get your water in. So I will be checking in on you guys who are coming to see me, especially my very busy professional people, and I will be asking, are you using this tip and how it's working for you? See you guys soon. Bye.